Hello, I am Dr. Fashrad Amini Behbahani and this is short course of Iranian traditional medicine. In this section we discuss about diagnosis, I mean taking history and some examinations. Every human being has two crowns, crown of creation and crown of humanity. So every human being, whatever religion has, should be treated respectfully. Get permission before examination and apologize to the patient if your examination is painful. Remember the enemies of the physicians, the enemies of the healers. Scientific pride is one of them. Try to improve your knowledge and information about the patient and disease. Hesitation in diagnosing is another enemy of physicians and healers. Check your diagnosis if there is any ambiguity or doubt in your diagnosis. Empowering the patient or looking from upside to the patient and obligation to the patient for following your order is another enemy of physicians and healers. Try not to obligate the patient to follow your orders. Try to propose your treatment to the patient. And follow your treatment if there is no proper response to your proposed treatment. Let the patient speak about his or her complaint and don't cut his or her speaking until there is no more explanation for the complaint, and then ask your questions. Ask about when or the time that complaint began. And if there are more than one complaint, ask which of them is earlier compared to the other ones. Ask about location and ask the patient to determine the complaint. Ask the patient to talk about quantity and quality of the complaint or describe its form for you. For example, there are several forms of pain that can lead to proper diagnosis. For example, traction pain and feeling a balloon in organs, for example, in the head, can lead to diagnosis of wind as a cause for the pain. Ask the patient about the factors that increase the complaint or the factors that relieve the complaint. Ask the patient about previous medications, drug abuse, previous treatment or procedures, and ask the patient why he or she come to you as a healer, as a traditional medicine healer. Ask about signs and symptoms in relative organs. There are some relative organs for each organ. For example, in headache, we ask about the condition of the stomach, the liver, the spleen, the intestine, and uterus and kidneys. A problem in this related organ can cause headache, and treatment should be focused on these relative organs. Then try to evaluate the patient. Actually, evaluation of the patient should begin from the first time that you see the patient by evaluating and assessing the force of the patient. For example, when he or she open the door of your office or shake your hand, or the power of walking of the patient, you can judge about the energy and force and faculties of the patient. A weak patient have weak handshaking, have a slow voice walking, and a slow opening of the door. And contrary, a strong patient walk very loudly and walk strong to your office or shake your hand strongly. And after that, look to the face of the patient. Evaluation usually begins from evaluation of the head and then go towards the toe. We call it head to toe evaluation. In the head, you should notice to the condition of the hair. Before that, I should mention that it is better that you teach your patients that do not use makeup or artificial color if it is possible before coming to your office or before you visit them. Try to determine the color of the hair or ask the patient from the true and natural color of the hair. If there is any white hair, if there is any broken hair, if there is any hair loss or shedding of the hair, and look that if the hair are pushy or soft or thick or curly or wavy, they help to judge about intrinsic temperament of the brain, and also if there are any problem. For example, we don't consider shedding hair or hair loss or breaking hair as signs and symptoms of intrinsic temperament. We usually consider them as signs and symptoms of a disease or weakness. Look at the face of the patient. If the face is fatty, and if the face is fatty, is it muscular? Is there any atrophy in the face, especially in temporal area and the orbit, that shows the atrophy sooner than the other side of the face? Look at the eyebrows. If there is pushy eyebrows or thin eyebrows. Usually in women, by makeup they thin their eyebrows, but thick and pushy eyebrows show previous sad situation. If there are any fast growing hair in the eyebrows, usually fast growing hair in the eyebrows show the warmness in the lung and the kidney. And look to the orbit color. A dark orbit or raccoon eyes show insomnia. It can be a sign of melancholic humor dominancy. Of course, if we have melancholic humor dominancy, we have loss of face luster. The face lose its luster and shiny color. And after that, look to the eyes. If they have proper movement, a proper movement is not too slow and not too fast or restless. A restless movement of the eye shows warmness in the brain, and a slow movement shows coldness in the brain. Usually, eye conditions lead us to the distemperament of the brain. Look at the eyes if they are wet or dry. Dry eyes usually is because of dry distemperament of the eye or dry distemperament of the brain. Tearing from one eye is not a good sign. Usually it shows warm inflammation in the brain. In cephalitis, we usually have one side tearing of the eye, but a proper wetness of the eye shows proper wetness of the brain also. Big eyes usually shows wet distemperament of the brain, and if large eyes be with slow movement of the eye, we will suspect to the cold and wet distemperament of the brain, for example. And of course it could be wet and cold intrinsic temperament if the function is normal. But if there is any unnatural function or any deficit in the function of the brain, we usually consider it a distemperament. Look at the scleral color. A gray color of sclera usually is melancholic humor icter, and a yellow color of sclera lead us to yellow bile icter. Sometimes we have problem in the stomach and we have just below side of the sclera discoloring, for example yellow color beneath the inferior eyelid can lead us to the problem of the stomach or the liver based on the other signs and symptoms. And notice to the spit and moles on the sclera, and if there are any of them, ask the patient if they are congenital or appear recently. Congenital spots usually have no value in diagnosis of acute conditions. After that, you should focus on the nose and nostrils. If there any dryness or redness or peeling around the nostrils, if there are any hypertrophic muscle around the nose, to open the nostrils wide, you should evaluate them.